Okay. Welcome, my dear friends. Myself is Professor Dr. Deshpande, and today is 16th of April 2020, and we will start the discussion regarding the research topic. Actually, everybody knows that research is a subject for the first year post graduation of Ayurveda, whether they are doing in any subject of MD or MS. It may be Siddhant, it may be the Rachana Sharira, Kriya Sharira, Dravya Guna Vijnana, Rasa Shastra Nidana, any fourth year like Shalya Tantra MS, Shalakya Tantra, Kaya Chikitsa MD. But they have in Ayurveda course, PG, they have the first year prelim examination regarding the research methodology and medical statistics. And that's why we are discussing something about research. I have taken the question from the university examination that write down the research methods in the ancient science. Ancient means in Ayurvedic science, what are the references regarding the research? Okay, that is my topic. And actually, I have completed my two videos or two lectures on that. And today, maybe the further discussion. But this is specifically regarding the research terminology, research language that was used in the ancient times. Now we are using aims, objects, title of the synopsis, then problem, then the research question. So many things we are discussing in our today's research language. But at that time, as I am telling you, the research was there in Ayurveda, research is there, and research will be there in Ayurveda. But they have their own language. I would like to talk much about the language. What is the importance of language? What is the importance of terminology? So my kind request, you first write down today this word, research terminology. Understanding of research terminology is very important in the research subject. To understand the terminology, as when we come after the 12th standard, when we come to the Ayurveda course, we must understand the Ayurvedic terminology. When we visit to the German country, then we must understand some basic terminology in German language. There is a terminology in physics. There is a terminology of chemistry. There is a terminology of the biology. So please write down this word. Research has its also terminology, language, research language. And now we will concentrate which were the words used in the time of Ayurveda, in the time of Samhita Granthas. Charak, Sushrut, Vagbhat, Madhavanidan, Yogaratnakar, all these people were definitely 100% scientists. And that's yesterday I had given you a lot of examples. So please see my previous videos regarding the research in Ayurveda. But today's my heading for the YouTube upload will be research terminology in ancient Ayurvedic science. So we will go, it's a little bit theoretical part, and it's a just comparison what was the word in Ayurveda and what is the similar word in today. But my request will be for all universities, all the Ayush department people, CCIM people, government people, that this particular terminology of Ayurvedic research should be used today also. Then the students will be more familiar and acquainted, and they will not have any tension about remembering those particular words. Let us see one word by another. There may be 30, 40 words. There will be 25 slides in this half an hour. First word is Pramana. Pramana is the word used in the Ayurvedic Samhita Granthas. Pramana means right knowledge. Like for example, we have the four Pramanas, Pratyaksha, Anumana, Upamana, and Shabda. I think I had discussed something about Pratyaksha, Anumana, Shabda, or Apta. Shabda and Apta is similar, authentic information. But in short, today I will again repeat you that Pramana are the sources of evidence. Proof. Research, always evidence is must. Always proof is must. That's why the modern scientific world is little bit not very open to Ayurveda, because Ayurvedic people, when they start claiming any tall claims, I can treat corona, we have the treatment for corona, This and that. I can treat paralysis. I can treat rheumatoid arthritis. I can treat Amavad. But I'm sorry to say, all you, me, and all Ayurvedic people should have these evidences, and that too TOO on our case papers, that too TOO in our soft copy of the computer. Many people, many Vaidyas are using the computer softwares. They are making their data feed in there. But when they start talking about any topic, any tall claim, they should prove their statement with the documents that they have. And then they must compile it together, publish it on the blog, publish it on the YouTube, and they must talk all the time with, see my case paper, see my soft copies. And they should give the link of their record. Then only we can say that Ayurveda is, can you see over here? Evidence-based science. We have the Purava in Marathi, proof in English, evidence in English. Pramana in modern language, in modern research word, it is an epistemological method such as the empirical knowledge, logical knowledge, authority knowledge, and analogical method. So these are the modern language of research. So we are always talking what is the word in Ayurveda and what is the modern term or modern explanation. Prameya, Prameya, that is object of right knowledge. That is the research problem. Whether my Amrutadi Gugulu tablet is useful in the cases of rheumatoid arthritis. This will be my research problem. This will be my research area, that is Prameya in Ayurveda. Only you have to write down these Sanskrit words, Prameya. You make a list at the end of the lecture, 1, 2, 3. First, we have already seen. First, I have made it bold. So write down Praman, number 1. We have learned the Pramana word, that is evidence. I will also make this bold. Okay, these are the evidences. Only short things you write down. Okay, these are the 4 Pramanas or the ways of getting the evidences. That is Pratyaksha, Anuman, Upamana, and Shabda. Prameya, as I have told you, this is the research problem. Prameya is a research problem. Give one example. Amrutadi Gul, whether it is useful in rheumatoid arthritis. This is my research question. This is my Prameya. We will take only one example for discussing the each word. Okay. Next, Samanya. Sorry. I'm sorry. This is not Samanya. This is Samasya. That is our problem. Samasya is again the same research question. My problem. Previous word and this word is same. Prameya is also the research problem. Can you see over here? Prameya. I will make it bold. Samasya. What is my Samasya? That is also the research question. So just write down Samasya is a research question. Prayojana. Sanskrit word. Prayojana. It can be compared with aims and objectives of our research. What is my aim? To find out the efficacy of Amrutadi Gugulu in rheumatoid arthritis patient. This is my target or the aim. And what are the objects? Objects are the steps to reach at my aim. Objects are the steps 1, 2, 3, 4 to reach my target. Now, in these days, these research people are making too many modifications. Sometimes they say you write aim and objectives. Now they are saying don't use the word aim. You write it primary objective and then whatever else is a secondary objectives. Only they have replaced the word aim as a primary objective. So these changes can take place always. So don't worry about that particular things. Okay. So Prayojana is aim and objective. Objective means the steps to achieve my goal or the target. For example, if I want to see the efficacy of Amrutadi Gugulu in rheumatoid arthritis, what will be my first step? To catch, to diagnose the rheumatoid arthritis cases and as per the inclusion criteria, take into my research. And then give that Amrutadi Gugul to them in a specific dose, in a specific days. That is my second objective. But final, my target is whether it is clinically efficient, my drug in the rheumatoid arthritis. Amrutadi Gugulu, Amruta is a Guruji or the Gulvel. Next, Drishtant, Drishtant, Drishtant. Okay, so this is the information available in public domain. Drishtant, familiar instances. Or here the most important is previous studies published. Write down previous published studies. Ayurvedic Samhita word is a Drishtant. Although it is in English, I am pronouncing Drishtant. Here you can add, I will add one thing, okay? Literature review. Literature review. So this review can be taken from Ayurvedic Samhitas, from the modern books, Google Scholar, not Google General website, not Wikipedia, okay? Then PubMed, standard collection. Then there is a Jamnagar site is there, Jamnagar College. Dr. Baghel sir has prepared some documents. Our Ayurvedic College Degree Pradhikaran has their website, and we have published the Ayurvedic Research Database. Ayurvedic Research Database, ARDB. You go on and search Ayurvedic College Degree Pradhikaran, you will get the website. You open the particular, as I have told you, ARDB, and then you will find a lot of references of the researchers. That is the Drishtant. Okay, whatever the past that has been completed. Next is the Siddhant. Siddhant is an established theory. Forget about this talent. I will say established theory. I will just remove that word to make a. So this is established theory. As you know that Ayurveda is eternal because of only Siddhanta, Panchabhotik Siddhanta. So here I will also take it a little bit up. These established Siddhantas are of 4 types. Can you write down 4 types? One is Sarvatantra, that everybody accepts. What everybody accepts? That the food, oxygen is necessary for life. Is there any confusion in Ayurveda, homeopathy, naturopathy, whatsoever, the allopathy? No. It is this particular Siddhanta, this particular principle of the life is accepted by everybody. That is called as Sarvatantra Siddhanta. Okay. Then Pratitantra. Ayurveda has its own theory. Tridosh Siddhanta. It is not explained in the modern allopathic science. So this Tridosh Siddhanta is a unique of Ayurveda. It is not mentioned in homeopathy. So that is Pratitantra. Tridosh Siddhanta is Pratitantra. Then hypothetical proposals. Hypothetical. Abhyupagamya. And some hypothesis, we have to accept some hypotheses. For example, in Ayurveda it is mentioned that Vata Prakriti people are prone for arthritis. Write down this example. I'm sorry, each time we have to add some examples. That is Abhyupagama, that is the Siddhanta, but hypothetical. We must prove it by evidences. Then contextually referred theories, that is Adhikarana. Contextually, we have to give the reference from Charaka Samhita, we have to give the reference from Sushruta Samhita, and then we say that particular theory has been established. Kalartha karmanam yogo hina mithyati matrika samyak yogascha vidneyo rogarogyasya karana. Bhagvat, reference from Bhagvat. He has mentioned 3 important causes for any disease, that is our Siddhanta. Okay, so this is hypothesis, theoretical construction of the research. Next is Avayava. Avayava is a components of the statement, part of the statements. Okay. For example, when we write out in the thesis, when we write down the here, can you see here? Methodology of research reporting. Write down these similar words. Okay. So this is methodology of the research reporting. That is Avayava. For example, there will be Pratijna. Every word I will make it bold. That is aims and objectives. Pratijna is aim and objective. Then reasons. Hetu, that is selection of the topic. Each word is important. Okay. Similar instances. Udharanartha, past preferences. Past preferences. This is one of the part of our research. Application, that is Upanaya. Upanaya, That is utility of my research. So this is all the things are the Avayav. I'm sorry, I'm not going fast because it may take one more lecture. I don't mind, but we will understand each and every word because this is the research, what you can say the terminology mentioned in Ayurveda. So we must understand each meaning of each word. Avayava is a part of our synopsis, different sections of our dissertations. That is nothing but your index. Whatever the index you have, first is the title, aims and objectives, materials and methods, observation, discussion, conclusion. These are all are called as the Avayava in Ayurveda. Okay. Tark. Tark, that is the deducting an unknown fact on the basis of different evidences. This I am making bold. Okay. What is Tark? Whatever we discuss and make a conclusion, conclusion is nothing but the Tark. I'm sorry, Tark. I can write even here only. Why not? It's like a conclusion. Conclusion. Okay, it will be helpful for you. Conclusion. Because we are deducting an unknown fact on the basis of different evidences. For example, previously I was not knowing that Amrutadi Gulu is helpful in rheumatoid arthritis patient. So I have made a group of the people, 40 people having the rheumatoid arthritis, 40 people without rheumatoid arthritis, case control studies. Then I have provided the tablets. Some group, a control group has given the placebo tablets. And then I discussed all these factors. And then I write down, yes, the patients of rheumatoid arthritis, if they come in early stage of diagnosis, this was my MD thesis. I had done MD in Kai Chikitsa and also MD in Kriyashari, 2 post-graduations. So my thesis was there regarding the Amrutadi Guru and rheumatoid arthritis. So I have proved, my tarka was that definitely it is, conclusion was Amrutadi Guru is helpful in a big dose. Nearly I had used the 1.5 gram, 500 milligram per tablet, 3 tablets 4 times in a day. And that is very useful for Amrutadi rheumatoid arthritis patient in the beginning without steroids, because modern doctors always prescribe the prednisolone. Why so long? But if the patient by chance comes to you, RA positive, you start this tablet, give it for 3 months, stop again, give it 3 months, definitely useful. This is Tark, conclusion. Nirnay. There is, I can differentiate, this is the first stage of conclusion. I will make it, this is modified, okay? First stage of conclusion. I will make it a small, no problem. We will go slow. My dear friends, please make a patience with me, because this is all important, which is not also given in my book. So this is another that I have developed all this material for you. So Tark is a discussion, end part of the discussion, and finally you make a Nirnay. Okay. There may be a little bit confusion you will find, because again here I have said the word discussion, etc. But I think this is more better. Final conclusion. I will write down that. I will omit this all things. Okay. I will omit this for your convenience. So Nirnaya, this is the word in Samhita. Nirnaya is the final conclusion. Okay. Let us go further. Vada. Vada is nothing but a discussion. Whatever our discussion topic in the thesis, that should be having discussion, chapter discussion, into bracket Vada. Okay. So accepting and rejecting the hypothesis to the consideration of finding, supportive finding. I will make it a little bit more simpler. Okay. I'm sorry, here I will have to make this little bit. Okay, it's not coming. Findings. I will add that word, findings. Okay, let us see what is happening. Okay, so accepting, here you can say, or rejecting the hypothesis that you do, that is called the Vada. Accepting or rejecting the hypothesis with due consideration on supportive or contrary finding. As you know, H0 and H1. H0 Research language, null hypothesis. H1 is a positive hypothesis. That comes under the Vada. We are talking about research in ancient times, and we are trying to mention in our LAQ what is the research terminology used by our Charaka Sushruta Vagbhata. Jalp. Okay, Jalp. So Jalp is a biased research or manipulating. This is most important. That means if I do the research of Amrutadi Gugul and rheumatoid arthritis, okay, and what I don't take the control group. I don't take the control group. So this is not the proper research, I can say. This cannot be the proper research. In ideal clinical research, there should be some control group. So if I don't take the control group, my research can be called as a biased research. Try to understand. And that's why Jalpa is mentioned as a biased research. Okay. Next, Hetwabhas. Hetwabhas, that comes under the errors and bias. Again, Hetwabhas means errors or the bias or faulty reasoning and plagiarism. This is just a comparison of the modern research terminology and Ayurvedic terminology mentioned in Samhita. So, my dear friends, I understand this, you may not feel it's a good lecture topic, but this is mandatory because this is expected by MD students who are doing Ayurvedic research. They must understand what is mentioned in Samhita, classical research. Hetwabhas is a faulty reasoning and plagiarism. Next, Chal. Actually, the pronunciation or in writing, you write on the Chal. So, Chal is a misinterpretation of technical terms. Misinterpretation of technical terms or keywords and mismatching of titles and objectives. So if it is a confusion, whatever you have mentioned, for example, I have taken Amrutadi Gugul and rheumatoid arthritis, and in spite of taking rheumatoid arthritis, I am taking any, what you can say, the arthritis patient and saying that Amrutadi Gugul is useful for osteoarthritis, cervical pain, back pain. So that is mismatching with my title. I have taken all the patient, but my title was whether Amrutadi Gugul is useful for the only rheumatoid arthritis. So that is called as a Chal. Okay. Next. Zati. I'm sorry, I have to just, this is similarity and dissimilarity. Similarity and dissimilarity, that is called as a Zati in Ayurvedic word. Some terms need not to be go for details. Then Nigrashta. Nigrashta is a pronunciation. Rejection of the thesis as a result of faulty practice. So if your evaluator, examiner has rejected your thesis because of some errors, that is called as a Nigrashthana. Again, I am saying this particular terminology, if MUHS, any university is mentioning, is officially using this language, then only then my Ayurvedic students will be interested to understand this topic. Otherwise, they know that my thesis is accepted, my thesis is rejected. But if they understand it is a Nigrashtana, then you will say, sir, what is the use to remember these words? Please, my dear friends, you will not understand the importance today, but at some time in your life, you will understand terminology of each science is useful for that science. So, Nigrashtana. Okay. Then another set of terminology mentioned by Charaka. Okay, we will go that one. For example, Charak has used these words. Karana. Karana is an instrument. Karana is a method. Intervention planned as a part of research. Okay. So, Amrutadi Gugulu is my Karana. I am using this tablet for treating the rheumatoid arthritis. So, Karana is a way of instrument that you are using for your research. Some people will use the culture and sensitivity test. That is their Karana or the instrument or methodology. Next, Karyayoni. Okay, Karyayoni. So that is the assessment criteria. Very useful word. Forget about all other things. Karyayoni is an assessment criteria. For example, I have decided rheumatoid arthritis RA positive as well as RA negative patients I will include. I will check the ARA, American Society, American Rheumatic Association, ARA, American Rheumatic Association has described some parameters to decide the rheumatoid arthritis. So that parameters I am taking, that is a Karyayoni. My dear friends, if you sincerely write down these examples, then you will be able to remember all this terminology. I understand that this is not directly useful for your practice, but for Ayurvedic science, this lecture is useful. Karya, what is Karya? That is the simple steps that you follow in your material and method. I can say that this is a method of the research. Karya is nothing but the method of the research. Or here they have said the effect of the intervention. Okay. For example, Dhatu Samya, this is our Karya. What is the final purpose of clinical trials? Dhatu Samya. That is my final outcome, what I am expecting. That is the results, what I am expecting, that is the Karya. Okay. Karyaphala, ultimate aim of the intervention. For example, when I am treating the Ayurvedic patients, what is the ultimate aim? Dhatu Samya is there. But finally, the patient will be happy. He will regain his quality of life. So that is Karyaphala, ultimate benefit to the society. What is the benefit of your research to the society is nothing but the Karyaphala. Okay. Anubandha, long-term effects of the activity. Okay. So for example, effects assisted through long-term follow-up in the form of risk and benefits. Here I can say another addition I can make. For example, here I will add, this is a market survey. Market survey, okay, SURVEY. After the first 3 phases of your clinical trials, the preparation, your product Amrutadi Gukul has been started, launched by patent has been taken by some Ayurveda company, and they have started to sell that particular product. But then if some researcher keep watch for the next few years and they write down what are the side effects, what are the benefits, additional benefits, then that is called as a post-market launching survey. Post-market launching, that is Anubandha, continuous process of evaluation. Desha, inclusion criteria, proper selection of the patients. That is, you can call it as a inclusion criteria. Inclusion criteria. Okay. This is that one. Okay. This is Desh. Okay. Next, Kal, time frame of the research. Some surveys are one-time research. If I want to clinical trials, it may be going on for 7 days, 15 days, 1 month, 3-month trials are there. So then I mentioned that this is a 0 reading, that is on the first day. Then 7th day I will take the follow-up. 15th day I will take the follow-up and see how much edema has been reduced, how much pain has been reduced. So time frame for the research is called as a Kal. This is very common word of Ayurveda. Pravrutti. So initiation of research, beginning of the research. You know that when you start the clinical trials, you have to report at the government. So this beginning of your trials is called the Pravrutti. You have started your activity, that is called as a Pravrutti. Remember this word, Pravrutti is a starting. Next, Upaya. Upaya is a research planning, number 1. Or design, research design. This word is very important, research design. Okay. Here also I will write down that word, research design, RESEARCH, research design. For example, some trials are open trials. Do you know this word? Open trial. And some trials are double blind trials, single blind trials. All these are the words from the modern research methodology. But we have some words in Ayurveda that is called Upaya, that is proper planning and fitness of the different components employed in the process. Next, acknowledgement with gratitude. This is not actually, the topic has been over. Try to understand. Just I am mentioning one of the research paper that I have taken for preparing this slide. That is a review article, and this is the name of the article. So I must have the gratitude towards these people, Dr. Vinod Kumar and Dr. Anup. They have written a big article on this. You can go on Google and search this article, review on the compatibility of the classical and contemporary research method in context of Ayurveda. Very good article. So thank you, Dr. Vinod Kumar and Dr. Anup. I am having obliged with your write-up, but I have tried to get this information for the benefit of the science, for the benefit of the Ayurvedic student. So they will definitely, again, my dear friends, coming back. So why I have used all this slide and PPT? Because although it is a boresome, but I think this is very useful because you have one question. Again, I will go back in the first slide. Describe ancient research methods in details and importance. And just I'm going to tell you the titles, and you have the look how the whole scenario has come. This is based on my book. I have written, or rather, I have edited one book, Research Methodology and Medical Statistics, published by Manakarnika Publication, Pune, Maharashtra State, India. And all Indian PG students of Ayurveda are using this. So I am thankful to all my well-wishers and the purchasers, all the students and the teachers. And there you will find the whole book has been written exactly on the basis of CCIM syllabus of research methodology and medical statistics. Every topic has been covered. The authors, of course, Dr. Sachin Sarpotdar is one of the authors. Okay. Then Dr. Ilabor, Dr. Santosh Bor, I am having gratitude towards this, and my senior teacher, Dr. Subhash Ranade, is also the what you can say editor of this book. So Ayurveda is a life science. Ayurveda is based on the research. I'm just going fast. Research is based on pramana, and pramana means evidence. Okay, these are four pramanas: pratyaksha, anuman, aptopadesh, and yukti. Then we are materials that we are using, or Ayurveda has used for the research is shrotra, tvak, chakshu, rasana, grana. Then role of mind as a Ubhendriya, it's like a CPU, and Chintya, Vicharya, Uyya, Dheya, and Sankalpya. These are the subjects of the mind. Methods used in the research: Pratyaksha, direct perception, Angulik Pramana is one of the example. Dissection is another example by Sushrut. Anumana, Agnim Jarana Shaktya Parikshet, Balam Vyayama Shaktya Parikshet. These are the Anuman. Yukti, patient diagnosis with Trivida Pariksha, Darshan Sparshana Prashna. Then Aptopadesh is a literary research. Then symposium and seminars were there. For example, research, a symposium regarding the test to diagnose the how many tests are there. Madhura, Amla, Lavana, Katutikta, Kashaya. Then research based on observation, research based on instant one-time observation for Rasa, 1 day observation for Vipaka, many day observation for Virya. Then many months observation to observe these gunas, Guru and Lagu. Then there is a Vegavastha and Avegavastha in Apasmara and Shwasavyadi. This is a research, try to understand. Then research based on observation, test decision, Katurasa and Kashayas, how they are diagnosed, Nadi Vijnana, Vata Nadi, Pitta Nadi, and Kapha Nadi. Then crossover trials like Gudalingam Vyadi, Upashya, Anupashya, Abhyam Parikshet. This was also mentioned. Then Visha Pariksha, animal experiments were done with the different animals. Then Madhumeha, ants are supposed or observed to attracted by the urine of the Madhumeha patient. Then classical and contemporary research. Classical means ancient and contemporary means present. Classical research was mainly based on in vivo trials in the human being, and modern research is in vivo as well as in vitro, that is experimental researches. Okay. Then Ayurveda is eternal science because it is time tested, and Ayurveda was there, research was there, research is there, and research will be there because of the fundamental principles of Ayurveda. These are the fundamental principles: Loka Purush Samanya Siddhant, Panchabhotik Siddhant, Dosh Dhatumar Siddhant, Samanya Vishesh Sat Karyavad, Kalartha Karmana Yogo, Hina Mithyati Matra Kaha, Samyak Yogashcha Vedneyo, Roga Rogit Karanam, 3 root causes of the disease. Siddhanta itself mentioned in the definition by Charak that it is a research because Parikshakir Bhavidam Pariksha and Sthapyate Nirnayaha. Conclusion was drawn on by doing the different methods of research. So this is the Bahuvida Pariksha, and Nirnay is a conclusion. Charak, this is the progress. Research makes the progress. Charak has explained only 5 types of Vata dosh. Sushrut has mentioned the Vata and Pitta types. Then Vagbhat has mentioned the 5 types of each: Vata, Pitta, and Kapha. Then there was a drug development. For example, previously only herbal drugs were there, but then Rasa Ushadhi came for the compliance by the patient, for the test, for the shelf life, for the fast action. Now today, Avian company from South India, they have started to prepare the Kashaya tablets. Even Sukshma Ushadhi, you can search for the Sukshma Aushadhi. Some Bombay Vaidyas is preparing this Sukshma Aushadhi. For example, Bhutvat Chintamani in a homeopathic style, Vasanta Kusumakar, and then they are very useful because they are very economical, because all these drugs are very, very costly. So if they are prepared by the homeopathic method, they are very used, they can very easily used and cheaper also. So cost effect is very nice. Okay, relation in between cost and effect. Then ancient research methodology, Praman is the means of right knowledge, Pratyaksha, Anuman, Upaman and Shabda. Praman means evidence, and that's why Ayurveda is evidence-based science. My dear friends, let me clear you, because we have the 5 minutes, only 3-4 minutes left. I have also the lecture at 2 p.m. regarding the respiratory system problems in the general practice. That may be very much, fascinating for you. Then there is a lecture at 4 p.m. also regarding the Vata Dosha. Especially, I'm talking in English always so that it can be useful for all India people who are interested to learn little bit about Ayurveda. So there are different terms. For example, Samasya is a research question. Prayojana is nothing but the aims and objectives. You can write it in a tabular form also. Drishtant, this is the literature review. Drishtant. Siddhant, established theory. It's a Sarvatantra, Pratitantra, Abhyupagamya, and Adhikarana. Okay. Then Avayava, this is the components of our thesis, components of our synopsis. Tark, final stage of conclusion, first stage of the conclusion, Tark. Okay. And Nirnay is a absolute final conclusion. Okay. Vada, that is the discussion topic of your thesis and the synopsis. Vada is the discussion topic, accepting or rejecting the hypothesis, H0 and H1, considering the supportive and contrary findings. Jalp, this is the biased research. Jalp is a manipulation. Remember, manipulation, biased research. Hetwabhas, these are also biased, faulty reasoning and plagiarism. Intellectual property right, IPR. Remember this word in the research. Intellectual property right, IPR. Plagiarism softwares are available and they find out whether you have copied down from any other research work that has been done without acknowledgement. Now you can understand that I have acknowledged the work done by some Dr. Vinod Kumar. Okay. Next, छल छळ कपट म्हणतो ना मराठीमध्ये आपण, थोडंसं दुष्टपणाचं, इट्स अ क्रुकेड नेचर. देयर वी आर what you can say, the manipulating all our thesis, and that is very wrong. Table made research. We have not done any clinical trials, we have not done any survey, and only sitting on the table we have written down. That is called a chal kapat. Then jati is a similarity and dissimilarity. That is a futility. Try to understand futility. This word I will make bold. Then nigrishta, rejection of your thesis. Nigrishta. Okay. Then used by the charak, karana. These are the materials that we are using for our research. Karana, instrument that we are using. Karyayoni, assessment criteria, inclusion and exclusion criteria. Karya, dhatu samya, or whatever our aim is, the karya. Karyaphal, that is the final outcome or utility for the what you can say, the society. I can write down there, utility for society of your research. Okay, so this you may make a little bit bold. Karyaphal. What is the utility of your research? That is Karyaphal. Okay. Next, Anubandha. As I have mentioned, it's market survey. Anubandha, long-term connection with your thesis. Desha, again proper selection of the participants, proper Prakruti determination, proper Sarata Parikshan, proper geographical Desh is also Desh. Human body is also Desh, geographical area where you are making research. In the hot countries, in the cold countries, in Delhi, in Pune, in Kerala. That's why there is importance of multi-centric trials. Why this is important? I will write down. Multi-centric trials. These new words you please write down. I know that there is very less time for me. Only 1 minute has left, but we will try to make it out. Okay, you can write down, add a corrections. Okay, multicentric trials. So this is that. Kal is the time frame of the research. Pravrutti is initiation of the research. Okay. then Upaya, that is a research design. So this is all about, this is completed topic now. Okay, this is the final about the research method, ancient research method. I have taken the 3 lectures. Please see my all the 3 videos and then you will understand. I am very much thankful for your support, your love, and I request all of you, please go through my YouTube channel. There is a playlist and you can see the different steps over there, different videos on different subjects. So my dear friends, this is all for today. I wish you all the best. Please do care, take care of yourself. Thank you very much. I am ending this meeting.